Hello, this is Dr. Eldred Taylor, and I'm here with one of our speakers, Dr. Philip Getson, and he will be speaking at our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November the 10th through the 12th, 2016. Now, Dr. Philip Getson is a family physician in practice since 1976 in New Jersey. He is an assistant professor of medicine and neurology at Drexel University Hospital in Philadelphia. He is a board certified thermologist and has reviewed more than 20,000 thermographic studies of the breast, thyroid, and neuromuscular systems. He has been certified by 4 thermographic boards and has lectured internationally regarding thermographic testing, having authored several papers on the subject. He has recently completed a 3-year term as vice president of the American Academy of Thermology, where he was responsible for authoring the breast protocols currently in use in the national and international thermographic communities. He is an internationally recognized expert in the diagnosis and treatment of reflex sympathetic dystrophy complex regional pain syndrome and has lectured extensively on this subject in this country and overseas. In addition, he serves on the Scientific Affairs Council of the Reflex Sympathetic Dystrophy Association of America. And in November, at the American Functional Medicine Association conference, Dr. Getson will be speaking on thermography and the detection of breast, thyroid, and neuromuscular abnormalities. Dr. Getson, how are you doing this afternoon?
Just fine, thank you very much. And pleased to be a part of this wonderful uh, meeting and looking forward to it.
Well, great. Well, Dr. Getson, uh, I want to hear a little bit about what we're going to hear in November. We're going to send this out to our prospective attendees, and we just want to get them a little taste of some of the exciting information that you'll be presenting. So, can you give us a little synopsis of what we can expect to hear?
Certainly, it'd be my pleasure. Thermography is the use of infrared imaging to detect changes in the physiology of the body. And as you mentioned, we look at the breast, we look at the thyroid, we look at the dental system, and we look at the sympathetic nervous system using infrared imaging. Now, most people don't know this, but infrared thermography actually predates mammography by more than a decade. So while most people take the conventional route of looking at anatomic testing for breast disease, which is mammography or ultrasound or MRI, thermography uses the physiologic approach, and as you know, physiology always predates anatomy in medicine. The medical literature suggests that the physiology of the breast predates the anatomy by as much as 7 to 10 years. So a subtitle to this discussion might very well be, what would you do if you knew sooner? Because if we look at the physiologic changes of the breast using non-invasive, non-contact, non-painful, non-radiologic infrared imaging, we can see changes in the breast that will predate the formation of tumors by as much as 7 to 10 years, which allows individuals to be proactive in their health, change their diet, change their lifestyle. And we have seen instances where the thermography, which is pathologic and asymmetrical, reverses itself in as little as a couple of weeks. And maintaining that healthy lifestyle of diet and nutrition, exercise, and all those things that we know is the proactive way of treating ourselves, the Eastern medical thought more so than the Western medical thought, we can really formulate a program for breast health that is proactive and intelligent. With regard to thyroid and dental imaging, it is well known that thyroid testing, blood testing, is woefully inadequate because people with thyroid symptomatology frequently have normal thyroid function studies. So again, we're looking at the physiology of the thyroid to determine whether it's functioning in a proper fashion. In doing so, we were able to determine that there is a tremendous amount of dental pathology, quite frequently that is the result of failed root canals or crowns or intervention by dentists that relates not only to thyroid dysfunction, but in some cases to breast disease. And while there is no significant literature on it, we have found a correlation between dental issues and breast cancer. Finally, we look at the neuromuscular system for what is the sympathetic dysfunction that leads to complex regional pain syndrome, and can also really elaborate on and demonstrate in vivid detail what most people look at as fibromyalgia. So the purpose of my discussion is threefold: breast disease, dental and thyroid issues, and neuromuscular issues of the sympathetic nervous system, using a tool that has been around since the 1950s, that again is non-radiologic, non-compressive, and non-interventional.
Yeah, Dr. Getson, I have known about thermography. My original training is in OBGYN. And I'm just wondering, why has the acceptance of thermography been so delayed? I mean, it's still, it makes it, in medicine, we're always talking about inflammation being the root cause of all of these conditions. And clearly, inflammation generates heat. This is what you're looking for with a thermography, a thermogram. Why is there why isn't it accepted? It seems so, uh, so much of a no-brainer, but it's you don't hear about it except from, functional medicine docs, but it just makes so much sense.
Well, I agree with you, and I think part of the problem is politics of medicine, and we can certainly spend hours discussing the politics of medicine.
Right.
But the politics of medicine and the companies that make mammographic equipment and the companies that make the imaging plates, there's a lot of money behind those people. And as you know, and I'm sure most of the people listening to this, cancer is big business.
Right.
We're talking about a diagnostic tool that may allow you to prevent or minimize cancer or cancer treatment, as opposed to a diagnostic tool that finds a cancer and then subjects you to the litany of treatment, which includes surgery and chemotherapy and radiation therapy. So I think that it's been kind of pushed to the background because of the money that cancer generates and the politics that the companies have to maintain their cash flow in diagnostic testing and therapeutic intervention.
Well, that's what I thought, but I didn't want to say it. I wanted to see if you, if you
I say it all the time.
So I was kind of baiting you on that question, but that was my belief, and I know you've been doing this for a long time, and I'm sure you've fought a lot of battles, been in a lot of battles, but it makes so much sense. I've been very interested in this, and it is even hard in Atlanta. It's not a whole lot of people who are doing thermographies. Uh, uh, there's not a lot of companies out here that are doing it. I think at first that it was. I saw that there were several companies, and then they seem to have kind of faded away. I just don't know. I don't know if it's because of the insurance reimbursement or what has been going on. Have you tried to fight that battle, the insurance reimbursement battle?
I have, in fact, taken the issue of thermography to the state Supreme Court in New Jersey.
Wow.
That's how high the fight went for me in the late 1980s and early 1990s. We had a 7-week court case followed by an appeal, followed by a verdict from the Supreme Court of the state of New Jersey. So you're absolutely right in stating that I've been fighting these battles, and I've been fighting them since 1982.
And so where is the fight now? I mean, what?
I think the fight right now is less, simply because the way that insurance has become in this country, where people have such high deductibles in their insurance policies, that to do a diagnostic study that costs $250 to $300, most people are willing to pay for it.
Right.
And women especially have come to the realization that mammography is not only harmful in terms of being painful with the breast compression, but we're using a diagnostic test in mammography that the United States government has said is a known carcinogen. So we're using a known carcinogen to see if somebody has cancer. And I think that women, more so than men, are becoming more and more enlightened. And they're saying, you know what, for that very small amount of money, I'll go in and pay for it because my health is more important to me than $300.
Exactly. Yes, that report by the U.S. government, it got about 2 days of press when it was, about not doing mammograms until age 50. That between 40 and 50. I've been singing this song for a long time, talking about women's health. Why are you using a diagnostic tool that on younger women that their thick breast tissue clearly says that it's not very effective. And you're right, radiating them over and over again, and also uh, um, compressing their breast is also damaging tissue that leads to inflammation, so on and so forth. I know I'm telling you the things you already know, but those damaging reports get about 2 days of press, and then we conventional medicine just keeps doing what they've always been doing. It's just really a crazy system. It really is.
You're absolutely correct. And part of what I will be discussing at the conference are worldwide statistics, none of which are my own, that come from studies that, as you probably have seen, have spanned as much as 25 years, which talk about the statistics of mammography and what the real answers are, what the real statistics are, and not what you're told, by the pink ribbon people.
Exactly. Right. Well, we better stop this before we get into too much trouble, Dr. Getson. I'm planning on putting this out on social media. We don't want the Gestapo to come after us. So we better stop. This has always been an interesting subject, and I'm glad you're coming because thermography is clearly a better diagnostic tool. It's a better earlier detection tool, and it kills me when they say the best cure for cancer is early detection. It makes my skin crawl when I hear those advertisements. No, the best way to cure cancer is to know early enough where you can do something. I didn't know that you could see changes, after 2 to 3 weeks. A pathological finding on a mammogram can be changed in 2 to 3 weeks. That's amazing. So, but anyway, so Dr. Getson, again, we could keep talking about this for a long time, but we are so happy you accepted our invitation. Thank you for your time this afternoon to talk to the people who are thinking about coming to our conference. You don't want to miss this information. This is very important. And since we are, even conventional medicine is talking so much about inflammation being the root cause of disease, this is a way that you can see it visually. Is that correct, Dr. Gesson?
That is correct. You can
Yeah.
see the areas that are inflamed that are exactly the root cause of problems.
Right. Okay. Well, thanks again. I appreciate your time. I'm looking forward to you coming in November. That will be our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November the 10th through the 12th, 2016. Please go to our website and register for this exciting event. Dr. Getson, we won't take up any more of your time. Thank you so much for joining us, and have a good evening.
Thank you. My